We're Sencha Health. We are in the business of streamlining and automating processes, and we have even automated the production of new software. Usually, we talk about the state of healthcare and health insurance in the United States, and today is no different. Today, we are going to discuss how the large U.S. payers bilked Medicare out of billions and how Sencha avoids this same fraud. I will be back after the presentation to discuss our conclusions and what this all means to you.
Today, we are going to discuss how Medicare didn't know they were being defrauded by the big health payers: Blue Cross Blue Shield, United Healthcare, Cigna and Aetna, BUCA. The article we will be referencing is from the Wall Street Journal, where they concluded a year-long investigation and published how health insurers racked up billions in extra payments from Medicare Advantage on January 2, 2025, with the details of the allegations. If you don't have a subscription to the OSJ, NSN has a free copy of the article, and both will be linked in the pinned comment below. The Wall Street Journal, WSJ, uncovered fraud perpetrated by the big payers against Medicare Advantage in 5 categories. Insurers packed on diagnoses that made them more money. 66,000 Medicare Advantage patients were diagnosed with diabetic cataracts and HIV, though no treatments were ever administered, and some had already had cataract surgery, making this diagnosis impossible. Insurers sent nurses to find diagnoses that doctors hadn't. When the payers weren't billing enough, they sent nurses to find extra diagnoses, triggering an average of $1,818 in extra annual payments during each visit from 2019 to 2021. $15 billion in total. Insurers got paid to cover patients who were already getting their health care elsewhere. Payers targeted veterans with cash-like rebate payments that encouraged them to sign up, the journal found. Nearly 90% of plans focused on veterans offered the rebates. These veterans got their medical treatments from the VA for no cost. When patients moved from traditional Medicare to payer-based Medicare Advantage, they appeared to acquire previously undiagnosed maladies. Those patients got 55% sicker, on paper, in their first year in United Health plans, an increase equivalent to every patient getting newly diagnosed with HIV and breast cancer, the analysis showed. Sicker patients who needed expensive treatments like nursing home care left Medicare Advantage at high rates, suggesting that insurers may have been denying them costly coverage. This is a sign, experts said, that patients may not be getting the care they need through the private insurers. When patients leave Medicare Advantage, taxpayers pick up the full bill for their treatments. These are 5 egregious fraudulent tactics that should have been caught and gotten the big payers completely shut down. Data science is a concept to unify statistics, data analysis, informatics, and their related methods to understand and analyze actual phenomena with data. Data scientists combine statistics, mathematics, artificial intelligence (AI), advanced analytics, and programming to unravel hidden and actionable insights from data. Data scientists are trained in and use linear algebra, probability theory, statistics, calculus, optimization. Benford's law states that the leading digit is likely to be small in many naturally occurring collections of numbers. The law of large numbers states that as the number of trials of a random process increases, the results average gets closer to the expected values or theoretical values. Note, this is not gambler's fallacy. Zipf's law states that any word's frequency is inversely proportional to its frequency table rank. Examining data science in detail is beyond the scope of this article. We mention it so that the reader is aware of its existence and capabilities. The fraud that was perpetrated by the big payers against Medicare Advantage could have been detected and stopped with any application of data science. It could have even been detected with a simple standard deviation that we all learned in middle school that would have stated something like, your HIV and breast cancer diagnoses are 4 standard deviations above the norm. We are going to need explanation before payment is issued. This is exactly the kind of technology we use at Cigna Health. Below, we are going to detail exactly what we do, but for now, we'll just say that we've automated the process of paying for healthcare. Therefore, if your doctor says you need it, you get it. We have to be careful, for the sake of the overall costs to patients using our system, that doctors don't attempt to pad their bills by just tacking on fraudulent procedures and expecting to get paid for them. We have a Director of Data Science, Matthew Titchener, on our staff for this express purpose. This is exactly why we can't trust government to come up with a single-payer system, and particularly why we can't have Medicare for all. The solution is to put health insurance companies out of business. You don't want bankers running anything. They crash the economy every 10 years on average, and it doesn't have to be that way. Yes, bankers are running insurance companies. The Commonwealth Fund identified several problems in their paper, U.S. Healthcare from a Global Perspective, 2022. Accelerating spending, worsening outcomes. That basically boiled down to two problems. Health insurance is too expensive. Patient education is largely ignored. If we can address these two problems, we can fix the U.S. healthcare system. Health insurance companies have two inputs, a patient and a procedure, and one output, a check to the practice for the procedure performed. That is it. If we automate the process between the input and the output, then we have eliminated everything the insurance company does. The only other thing we need to add would be some way to educate and incentivize the patient on how to live a healthy lifestyle. That would result in fewer claims, causing reduced rates for everyone. We at Cigna have designed and developed a solution that completely automates health insurance. We provide the electronic medical records, EMR, system to the practice, and when they code a patient encounter, we pull out the procedures performed and pay for them in real time. There is no adjudication, no denials, no medical coding, no big buildings, no people, and most importantly, little to no cost once the system is built. For this service, we charge $10 per month plus the actual cost of the risk. Remember that your health insurance company only returns 53% of your premiums as benefits. We can return the 47% they waste, on average, to the patient in lieu of the previously stated $10 per month, plus the actual cost of the incurred risk. There are other efficiencies we will explain, and a way to manage chronic, behavior-based disease. Also remember that treatment for chronic, behavior-based disease consumes 84%, or $3.7 trillion, of the $4.4 trillion spent on healthcare each year in the U.S. The average of avoidable deaths per 100,000 in OECD countries is 225. In the U.S., it is 335, or about 33% higher. If we could bring the U.S. average down to the OECD average, we would save about $1.2 trillion. That is a further reduction in costs of about a quarter of the total. How do we do this? We offer financial incentives for people who live a healthier lifestyle as measured by our built-in health and wellness system. This system takes into account measurements taken at the primary care physician's practice, like height, weight, and blood pressure, plus things screened for in blood work. Additionally, there is a mental health screening right in the wellness package. This system looks at all these factors and then prescribes patient education based on the results. At Cigna, this is part of the system. We can tell when the patient opened the patient education and how long they spent reading it, and offer a small discount for simply doing so. A larger discount is offered for reading and following the education, as evidenced by better results in the patient screening. Let's look at big round numbers. Let's say we can save the patient about 40% on their health insurance up front. Let's say that we save the people of the U.S. another 25% by being educated about healthy living and getting to the average OECD deaths per 100,000. We know that eliminating medical coding, providing a free EMR to the practice and putting compliance and efficacy reporting into that system will save each and every practitioner an additional $77,000 per year that they currently spend. That, however, is only about 2% of the total, so we'll just ignore it. If we total all that up, we see more than 60% savings. That means that we would not only have the best healthcare on the planet, but also the cheapest.
The way that health insurance is run is a complete scam. We have shown a way to save about 60% from the cost of health insurance and have addressed both of the Commonwealth Fund's two conclusions about health insurance in the US, cost and education. We have all of this written and deployed in a prototype application. The only thing we really need to get this all started is to clean up that application and turn it into an enterprise application with logging, administration, and redundancies in hardware. We will need funding, probably about $100 million over the first 2 years, like other startup health insurance companies. For comparison, United Healthcare had revenue of $371.6 billion and net earnings of $22.3 billion. With about 60% savings, we should service and retain 90% or more of the 330 million insured people in the US. That gives us a revenue of $36 billion. Everything in our system is automated, however, so that is a $32.4 billion profit at a 90% profit margin. This figure shows that this is a viable business proposition. We have shown a way to make patients healthier by educating them on the consequences of their behavior, and a way to capitalize on that to the sum of $1.2 trillion, or about 25%. If we add that to the process automation savings of our solution, we are in the ballpark of more than 60% savings in total. We already have the best doctors and the best equipment. We just need to implement the above detailed framework to give them all the tools necessary for success. We have this system in prototype now, fully functioning. Contact us here or on our site, and we will be happy to provide a demonstration of the fully functional prototype. If you liked what you heard, please like and subscribe, click on the notification icon, subscribe to our newsletter, and follow us on all our social media and blog sites. You can read the text version of this presentation at senchahealth.substack.com. We have built a comprehensive health information system to keep the patient healthy and on the right track with the ability to incentivize healthy living. Implementing this system should be fairly simple and will completely revolutionize the way healthcare is paid for, saving countless lives. We have shown a way to use this system to make the best healthcare system in the world, also the most efficacious and the most affordable, and a way to move toward value-based care.